So let's look at cancer prevention versus cancer risk reduction. And I have to apologize in advance. It seems as though this here may not go away. So when we're talking about prevention versus reduction when it comes to cancer, what do we mean by that? Cancer prevention is something that you're able to not have to deal with, period. So one of the cancers that is really big when it comes to cancer prevention is cervical cancer. Nearly all cases of cervical cancer is caused by HPV. And so that's why there was this big push to get the HPV vaccine for the younger kids. That's beyond the scope of this presentation. But the bottom line is, if you don't have HPV, then chances of you getting cervical cancer is not going to happen. As you can see, HPV is responsible for approximately 95%. And at one point, we used to have a lot of cervical cancer. But once we start doing the pap smear, I'm going to put a plug in for that as well. Make sure you're getting your pap smear. Once we start getting our pap smear and all that, the cervical cancer rate in the US has taken a dive. It's like, wow, right? So we need to get that done. And for those who do have the HPV infection, it's usually 16 and 18. If it persists, you can get precancerous lesion. That's where the pap smear comes in. Because if you're having your pap smear, they see something, they can just remove it and they'll do it more frequently. I think now they have it where they're doing 3 years, 5 years. They keep changing it. So don't take my recommendations on that one. Talk to your primary care, your gynecologist, and find out when you should do. But cervical cancer is a cancer that you can prevent if HPV is a cause and you don't have HPV.